I want to bring information to people of all ages about living well all your life, including things about your health, your finances, your family, meditation, exercise, because I believe that people, even though we're getting older, you've got a right to know ways in which you can improve your life, all of your life. And particularly towards the end of life, I think it's important that people have power and choice over how they decide to live their life. And I've been around people who've died in the past, and they've actually died well. They've been able to understand that their time has come and prepare for it. They've had conversations with myself and with the people that they love. And even though it's sad and very hard, it means that somebody can approach the end of their life with nothing left unsaid, no regrets. And that has a huge effect on the person who then continues to live, because my memories of those people are complete. I had a lovely time. I was able to tell them I love them. They were able to tell me they loved me. I could be with them in all honesty as they passed away. And as difficult as it is, it's memorable and it's the real pointy end of life. And I want that for everybody, if possible. It's an absolute privilege to know that your time has come and to be able to prepare for it. Unfortunately, I've also seen the opposite, where people deny their mortality and they deny themselves the chance to have those conversations with the ones they love because they're too scared. So the other thing that's happened in the last 30 years is that we've got all this medical technology and inventions, and we can keep people alive for a long time. And my belief is that just because we can do something doesn't mean we should. And I want normal, ordinary people to be able to decide whether they do or don't want certain types of medical care. I want doctors to be able to listen to what their patients want. Most doctors do want to listen, but patients up until now have been a little bit uninformed and out of the picture until it's too late. And then suddenly there's a crisis and people have to make decisions at 2 o'clock in the hospital corridor with a junior doctor about what medical care you think the person does or doesn't want. I introduce some scenarios that people may not have considered. And even though it's a little bit difficult to consider those scenarios, we try to make it as easy as possible for you. And you think about medical scenarios that you would or would not like in your own life. And as we get older, some things are less acceptable to us than others, so you can update your choices as you get older. The important thing for me, though, is that people discuss with their loved ones what they do and don't want, particularly as we get older. I was talking to a young girl yesterday. She's in her 20s. She lives here in Australia and her beautiful family live in Italy. And she said when she goes to visit them, she wants to have really good conversations with them. She doesn't want to just argue or talk about irrelevant things. So she said that my advanced life care would be a way to introduce some of the more difficult conversations with those people. Nowadays, we think we're going to live forever. And we have medical technology that is almost ahead of our ability to understand what it can and can't do for us. So I'm interviewing experts and trying to get information onto the website so people get updated and informed about changes, and they can then stay up to date with any changes and perhaps have renewed conversations with their family all the time.